Good afternoon, everybody. Thank you for joining us today. I'm just going to go over a few housekeeping things before we get started with our webinar today. If you're in an office environment or anywhere that's noisy, we please ask that you mute yourself so that we can hear our presenter or anybody that has questions. For our clinical skills training will be at North Mississippi Medical Center, West Point. That will be on Friday, January 11th, and there will be a morning and an afternoon session. If you have any questions about that, feel free to reach out to us or visit our website, cheerequity.org, for more information about that training. And in the spring of 2019, we're getting our webinar schedule lined up. So January 9th, we'll have Sustaining Breastfeeding and the Baby-Friendly Hospital Initiative in Mississippi, which will be presented by a few different representatives from Mississippi. And on February 13th, we'll have Dr. Liz Bode from the University of California, San Diego, present on human milk oligosaccharides, benefits for the breastfed infant and beyond. Again, if you're in a noisy environment, please mute yourself and hold your questions until the end. If you think of a question during the presentation, go ahead and put it in the chat box, and we can read those aloud at the end if there's enough time. Thanks. I'm going to turn it over to Trish.
Great. Thanks so much, Paige. And good afternoon, everyone. I'm just really thrilled to join you here today, and I want to extend you all a really happy holiday and holiday season. And extend my heartiest congratulations to Merit Health Wesley, who was just designated yesterday. So congratulations to the hospital for the incredible work they've done, and congratulations to the team there. And also congratulations to CHAMPS, because I know CHAMPS really has been very helpful to all of you in trying to sort through the challenges that you're facing as you strive to become baby-friendly designated. And they've been very successful in really helping a lot of hospitals work through those challenges. And so congratulations to you all. It's quite an accomplishment. So today we're going to talk a little bit about the update to the 10 steps to successful breastfeeding, as well as the updates to the Baby-Friendly Hospital Initiative released by the World Health Organization earlier this year. And I'll just talk a little bit about what does it mean for U.S. hospitals, and obviously in particular, what does it mean for your hospitals. So if we could just move to the next slide, Paige, I'll kind of review those objectives. Thank you so much. So I want to introduce you to some new things about us. I'll talk to you a little bit about the various WHO and UNICEF documents that have been released in the last year, and just explain a little bit about what those documents are, what they mean, how we use each of the documents to guide our work, and what they mean for you. We'll then go over the revised 10 steps to successful breastfeeding, and then discuss the implementation plans as well as timelines for when we're going to transition over to the new materials, and it's not any time immediate, so don't anyone get nervous at the beginning of this presentation. Let me take down the temperature right away on that topic. We've got some plans, and we're going to be working through those plans and give you plenty of time to make the transition. But before the end of the time, I've kind of prepared some questions on some commonly asked questions and answers that we've been dealing with on this topic, and hopefully we'll have a little bit of time to address some of your specific questions. So, Paige, if we could move to the next slide. So, drum roll, please. I'd like to introduce you to the new babyfriendlyusa.org. So if we can look at the next slide. You probably saw in the advertising for this webinar, we have a new logo, and so we love this logo. It's sort of, as I'm sure you recognize, it's a mom's view of her baby as she's breastfeeding. And so our new tagline is upholding the highest standards of infant feeding care. So we think this new logo and tagline are really strong and really send a positive message about what we really are all about, and excited that this is going to be how we're led into the future and how we work with you into the future. So if we could look at the next slide. along with updating our logo and tagline, we have updated our website and have a completely new look to our website. So if you've not yet had a chance to visit babyfriendlyusa.org, I encourage you to do so. The public-facing portion of the website has much more information about our program and our work, and hopefully you'll find it much more clear in wherever you are in the process, as well as we've added a couple of new critical pages that we hope will help you clarify to your patients and to your colleagues in your hospital a little bit more about what Baby Friendly USA is all about and what the Baby Friendly Hospital Initiative is all about. So if we can go to the next slide page, it takes us to one of the first new pages that I think is very important. It addresses common misunderstandings about the Baby Friendly Hospital Initiative. And obviously you can't read what some of those common misunderstandings are on this slide. The print is way too small. I just wanted to give you a good screenshot of what the page looks like so you would recognize it when you get there. But we've taken various topic areas that we've heard comments on. So the first topic area you'll see there's infant feeding practices, and then there's rooming in, purchasing of formula. So we've taken things that we've heard egregious myths about and identified what is not true and then provided you with information on what the truth really is. So a common myth we hear is that Baby Friendly forces all mothers to breastfeed. And, of course, as you all know, you're far enough along in your work, that's not true. We certainly want every mother to have information about the importance of breastfeeding. We want you all to be able to work with mothers and help them overcome any barriers or challenges they have with breastfeeding. We want you to educate them about the impact of alternatives on the health of mothers and babies, but ultimately when all is said and done, we respect a mother's informed decision. So that's all laid out on this common misunderstandings page. So encourage you to go through that. I think you'll find that very helpful, and I would encourage you to urge your colleagues to go through that, particularly naysayers, because I think it does help dispel some myths that you're often facing and probably get tired of answering. So if we could go to the next page, please, the next slide. So we've also put up a safe practices page of our website that had previously been there, but I think it's more prominently found. And you can get to the safe practices page from on the website from our home page. There's a quick jump button. I know there's a lot of conversation in public media about the safety of practices, and we address those practices. We address the importance of safety first on this page and offer guidance to staff for how to make sure practices are safely implemented in your facility. So if we could move to the next slide. We've also updated our 4D pathway graphic, and it's got a couple of new features to it. I think the piece that I'm most excited about in terms of the addition to this graphic is down on the bottom. Post-designation, we've added the critical aspects of how you work on sustainability. Going through the baby-friendly process is very labor-intensive, as you all know, and you're not only wanting to make sure you put the practices in place so that you can achieve designation, but you don't want all that hard work to result in some backsliding post-designation. And so we do have a post-designation process, and this graphic includes that post-designation process, as well as the next couple of slides show a little bit more about that on our public faces, the public-facing portion of the website. So if we could look at the next slide, the designation process is clearly outlined on the website, as it always has been, and the same information that we had on the old website about getting started in the 4D pathway and timelines and details. That's all included in this process. But what we didn't include is the information on the next page. So if we could have the next slide, please. and that is we didn't really previously have detailed information about our expectations regarding how you would maintain your designation. So this page of the website includes a lot more detail about the annual quality improvement process as well as the redesignation process. So I encourage you to peruse the website. There's a lot more information there. You've heard me present on this information in the past, but it is reinforced now on the website. So if you have any additional questions, you might look at the website before contacting our office. There's a lot of detail there, but always feel free if you've got questions about our processes, either reach out to your CHAMPS coach or be glad to take your questions if you reach out to us directly. So if we can move on to the next slide, we'll get into the topic area that you actually asked me to discuss today, and that is the updated materials from the World Health Organization and UNICEF, and what does that mean for you all as you're going through your current baby-friendly journey, and what does that mean for you in the future. So WHO and UNICEF released 2 documents. The documents look nearly identical. I mean, the coloring of the cover, the pictures of the babies, and to make things even a little bit more confusing, the documents are named almost the exact same thing. So the titles of the documents are Protecting, Promoting, and Supporting Breastfeeding Facilities Providing Maternity and Newborn Services. And you'll notice the document on the left side of your screen, in the white upper left-hand portion of the document, it says guidelines on there. And then the document on the right side of the screen, on that white field there, it refers to implementation guidance. And so the big question is, what are these 2 documents? How do you use them? How do I use them as Baby-Friendly USA? And what do they mean for the long-term baby-friendly hospital initiative? So let's just go through these documents one at a time. So if we could move on to the next slide page. So the first document was released in 2017, in early November of 2017, and it is a guideline. This particular document consists of a review of the evidence conducted by the World Health Organization and UNICEF pertaining to the 10 steps to successful breastfeeding, and it consists of a series of recommendations that they are now encouraging maternity facilities to incorporate into their practices as they relate to the 10 steps to successful breastfeeding. So they went through a fairly significant process of literature review, predominantly Cochrane reviews, and they looked for all the evidence they could find on each individual step of the 10 steps to successful breastfeeding. They felt there was sufficient evidence about the combined 10 steps to successful breastfeeding, but they were somewhat curious about what is the effectiveness of each step individually, and that's what this document is all about. So they did an individual review of each step, and based on that review, they came up with their generalized recommendations that ultimately fed into the next document. So if we can look at the next slide, let's talk about what the WHO considers a guideline to be. So for their purposes, a guideline is a document that contains a health recommendation about a health intervention. So it could be a clinical guideline, or it could be a public health policy guideline, or it could be just a general public policy guidelines. But they are the general recommendations that WHO recommends for inclusion of care or policy, et cetera. Guidelines are not implementation guides. So that brings us to the next document, which is the BFHI implementation guide. So if we could just switch, thank you, to the next slide. So this document here is the BFHI implementation guidance. This document was released on April 11th, 2018, and it was released in accordance with WHO protocol. It was released to the general public all at one time. So national authorities for the Baby Friendly Hospital Initiative did not have a sneak preview of what the final document would be about. It was publicly available to all of us all at one time. So you all got a chance to see it at the very first time that I and all of my BFHI colleagues around the world got a chance to see it. And so we're all digesting the document together and working through it together and figuring out the best ways forward for implementing this document. So let's go on to the next slide and talk a little bit about what implementation guidance is. So implementation guidance in accordance with the WHO is a strategy or series of strategies that may be utilized to implement a recommendation about a health intervention. So this document is the document that WHO is providing to all national authorities of the Baby Friendly Hospital Initiative to guide us in the implementation of the Baby Friendly Hospital Initiative in our own countries. This particular document, WHO has felt that it was time that they empower us to do a little bit more decision-making around the Baby Friendly Hospital Initiative, and they've been a little bit more flexible in their guidance. And so I'll talk a little bit more about that flexibility in just a few moments. But in the past, WHO did expect us to very rigidly adhere to everything they said. And they've now begun to realize that there are certain things that are more applicable to certain parts of the world than other parts of the world, and they've empowered us to be a little bit more flexible in terms of how we go about implementing plans. And that's why it's called implementation guidance instead of implementation requirements. So that's been very helpful for us. So we can look at the next slide. Thank you. The goal of this implementation guidance is to reinvigorate the Baby Friendly Hospital Initiative. Last year, 2 years ago, in 2016, we celebrated the 25th anniversary of the Baby Friendly Hospital Initiative. And in celebration, we conducted a couple of activities. First of all, countries around the world gathered together at the World Health Organization at a BFHI Congress. And we talked about the successes of the initiatives as well as opportunities for improvement. And that was one of the organizing strategies that was used that ultimately led into the updated BFHI guidance. We also took a look at the overall global adoption of the initiative. And while we in the United States are doing amazing work in incorporating the Baby Friendly Hospital Initiative strategies into our practices here in our hospitals, we have over 1 million births in the U.S. baby-friendly hospitals. Around the world, less than 10% of hospitals are fully adopting the Baby-Friendly Hospital Initiative, or at least at this time. There had been hospitals previously that initially implemented the initiative and then let their certifications lapse as other priorities came into play. And so WHO really is looking at this implementation guidance as a call to action, a global call to action to get everybody on board with incorporating the Baby Friendly Hospital Initiative in their facility. They are, and that's where some of their flexibility came in. They feel that they needed to give all of us a little bit of flexibility so that we could set attainable goals for our countries, for each our own countries, because they do recognize each of us are in different places, and that we may need some flexibility to set more realistic time frames for implementation in some places than in other places. But their ultimate goal is that we have a 100% scale-up of the Baby Friendly Hospital Initiative. And I will tell you, as I meet with WHO on a monthly basis, I talk to them about the things that are going on in the United States. And one of the things they're always excited to hear about is what is happening in Mississippi. They've heard about the work that you're all doing, and they're very excited, and they follow your efforts very closely. So just want you to know you're globally famous, and everybody is cheering you on because you're doing such amazing work. And you are a bit of a model for the rest of the world. And so we're really grateful for the hard work you're all doing there. So if we could look at the next slide. So as part of the process of looking at each of the individual, the evidence for each of the individual steps of the 10 steps of successful breastfeeding, the WHO saw really a terrific opportunity to update the 10 steps. And they had some ideas of reorganizing them and repackaging them. And many of us felt that some of those ideas were a little bit too much in that we've all worked with the 10 steps of successful breastfeeding for so long. They're so familiar to us. Any sort of a renumbering or recategorizing of those steps would create a little bit of confusion. And so the compromise idea was to refresh the new 10 steps, incorporate some of the critical aspects of what they had hoped to put into a different set of 10 steps, just incorporate some of those into the current concepts and the current 10 steps. So what you see on the screen is their revisions, and you'll see that step 1 has now 3 components, and that is because there were certain things that WHO felt was really important that came out of the evidence that they really wanted to make sure they built into the steps and didn't let those be kind of a sideline to the initiative. So the first thing you'll see is step 1A is comply fully with the International Code of Marketing of Breast Milk Substitutes and relevant World Health Assembly resolutions. So you're all at this stage of the game fairly familiar with the International Code of Marketing of Breast Milk Substitutes. WHO put this front and center in step 1 because they believe this is so important and that it's so critical to our thinking as we provide care. We should always have the code in mind that are there any commercial influences in any aspect of the care we're delivering, and is there a way we can make sure we keep that out of clinical decision making as well as patient education. So it's put there front and center as a reminder to us all of the importance of making sure that we provide evidence-based information to our patients that's free from commercial interest. So it's a really positive statement on their part. So step 1B is the same familiar step that you've all come to know and love, and that is have a written infant feeding policy that is routinely communicated to staff and parents. So that's the current step 1, and so that's not really a change for you. But they also recognize the importance of monitoring, and so they've added step 1C to inform facilities of the importance of establishing ongoing monitoring and data management systems. Now, we here in the United States are ahead of the curve on this one. Well, first of all, through the data collection and reporting that you're doing through your TAMPS project, as well as the data collection that you do in D3 when you get your audit tools from Baby Friendly USA. Those audit tools, as some of you know, are the same tools that we use to monitor practices post-designation. So the D3 audit tools are used in the annual quality improvement process so that our point is that you build data collection systems and monitoring systems that really just help you monitor and maintain those practices. So we're already ahead of the game, and we've implemented many of these new ideas that WHO has come forward. Secretly, I like to think they took those ideas from us, but they probably would tell you they took them from a lot of different places, but we're excited about that. So step 2 here is also a bit of a change in that they've removed the focus from training all staff. So there's, instead of like a focus on a 20-hour course, there's really much more of a focus on competency verification. So the new step 2 reads, ensure that staff have sufficient knowledge, competence, and skills to support breastfeeding. And so the intent of this step now is to make sure that we are focusing our efforts more on competency verification versus just seat in the classroom having information sent to folks. I'll talk a little bit more about this in just a few moments. We are still waiting from WHO for some additional guidance on what their vision is for the implementation of this step. They got their implementation guidance out back in April, and the training materials and the training plan is still being worked on, and we don't expect to see that until late spring of next year or early summer. So step 2 is a little bit real fluid for us at the moment as we're working through the implementation guidance. We're really anxious to hear from them on what their further thoughts are on how that will be implemented. But now, as you move into the steps that are called the clinical practices, step 3 remains very similar to what we currently have in place, and that is discuss the importance and management of breastfeeding with pregnant women and their families. So it's still a very similar focus to the focus that we currently have in place with step 3. Step 4 is facilitate immediate and uninterrupted skin-to-skin contact and support mothers to initiate breastfeeding as soon as possible after birth. So while the wording of this step has changed from the wording of the original 10 steps, the meaning of the new 10 steps has been in place for a bit of time in the United States. So we shouldn't see this step as being a radical departure from what we're currently encouraging you all to be doing under our current guidelines and evaluation criteria. Step 5, is support mothers to initiate and maintain breastfeeding and manage common difficulties. That is very similar. It's different wording to the step, but it is very similar to what our current step 5 discusses and is addressing. Step 6 is do not provide breastfed newborns any food or drink other than breast milk unless medically indicated. That's very similar to the current step 6. Step 7 is enable mothers and their infants to remain together and practice rooming in 24 hours a day. And when you read their implementation guidance, their interpretation of 24 hours a day is very consistent with our current interpretation of 24 hours a day. It's allowing the 1 hour of separation and or separation in the event of medical indication. Step 8 is support mothers to recognize and support their infants' cues for feeding. Again, very similar to the current step 8. Step 9, there's a significant difference in the new step from the old step. The emphasis is now on counseling mothers on the use and risk of breastfeeding, of feeding bottles, teats, and pacifiers, rather than an outright ban on their use. And so this step we're still wrestling with in terms of the best way to go forward with the implementation. This has caused the greatest amount of controversy globally in terms of how the evidence was looked at and what's the best advice, particularly for hospitals who are dealing with mothers in such a short period of time where breastfeeding is being established. And so while the thinking is that for hospitals in the newborn period of time, we're still wanting to really keep the emphasis on breastfeeding and using the responsive feeding to stimulate the mother's milk supply. And we're still being really cautious about use of artificial bottles to nipples and teats, but the outright ban has been removed. And then step 10, there's also some significant changes to the language where it talks about coordinating discharge so that parents and their infants have timely access to ongoing support and care rather than fostering the development of these programs. There is a presumption that many of these programs are in place already, so that the step language was changed there as well. That caused a bit of a stir globally as all of these 10 steps were out for public comment. So these are the new 10 steps released by WHO and UNICEF. Let me just say here and now, We are not currently using them in the United States. We are currently using the 2016 Guidelines and Evaluation Criteria, which consists of the original 10 steps. We are developing plans, and we're in the process. We're implementing plans now to make the transition. But we've got over 1,000 hospitals that are in our program, and making a smooth transition and a thoughtful transition is really important. So my instructions for you are stay the course. But I just want to make sure we introduce these to you all so that you know what's coming. And we'll keep you up to date on our plans as we continue to unfold them. So if we could move to the next slide. When WHO released the new implementation guidance, they also released a new set of infographics. And so there's also an updated 10-step poster. We have not yet adopted the use of this poster because we've not yet adopted the new 10 steps. And so we didn't want to create confusion by using this poster at this particular moment in time while we're still using the original 10 steps. But just wanted you to see this poster, see that it is released by WHO, so you at least know where it came from, and we'll be making, we'll be communicating with you about when it's okay to start using the poster at what particular point in time. In the spirit of transparency, some of our hesitation for saying, yeah, go for it right now, it's kind of cool to have this nice participant-friendly or patient-friendly infographic explanation of the 10 steps. There are a few images on here. Once we did a close examination of them, we were like, oh, I'd like them to tweak this a little bit before we use them here. They're not quite exactly conveying the message we like. And so we'd like to have a little bit more conversation with WHO to see if some adjustments to some of those infographics could be made. So we'll see what happens, and we'll let you know once we hear back from them. So, Paige, if we could have the next slide. So just kind of now getting to where we are. So that's what WHO has done as of April 11th of 2018. So in the past, when WHO has updated the Baby Friendly Hospital Initiative, and the last time they did that was in 2009, when those updates were made, they rolled out an entire package at one time. And from my standpoint, what an entire package is, from the standpoint of a national authority, an entire package for the BFHI consists of an updated self-appraisal tool, updated data collection tools, updated audit tools or monitoring tools of some sort, and updated assessment tools. Now, we've never taken their tools verbatim and used them exactly as they've rolled them out. We've always had to tweak them for applicability, but we've always had the entire package all at one time. They've also always simultaneously rolled out updated training materials and updated training guidance. And so if we could have the next slide, that hasn't happened this time. Now the materials are coming to us incrementally. So it was a monumental undertaking for WHO to update the evidence. Coming up with a review of the evidence from their standpoint, they had not done this, get this, since 1998. They hadn't really looked at all of the evidence systematically. They've looked at the evidence, new evidence documents one at a time as Cochrane reviews have come out, but they never really took an overall view of the Baby Friendly Hospital Initiative, or they hadn't done it since 1998. And so looking at the evidence was a monumental task, and then taking the evidence and building it into the implementation guidance was a monumental task. And so they've been really trying to keep us up to date and get materials out to us as they can. They didn't want to hold on to things as they completed their work, but receiving that information incrementally has made it a little bit difficult for us to do our rollout. And so as we are planning for updates and making changes, we're still receiving information and guidance from WHO. So it's sort of an emerging, ongoing process. But we have been informed that we expect to receive the updated training course by the summer of 2019. So that would be next summer. They hired a consultant, and we advised them on an expert panel on what the content might look like and how competency verification might take place. And the consultant has been working on building those recommendations into a new course. My understanding it will be pilot tested this spring and hopefully a final document released over the summer. We also know that WHO will be posting some updated frequently asked questions to their website, and they've recently committed to some additional technical assistance guidance for all of us. So information continues to come forward on their expectations as well as tools and materials to assist us in assisting you in making changes that they're recommending. So with that said, let me just move on to the next slide. And what I have learned whenever I talk about the Baby Friendly Hospital Initiative, I have to talk from two perspectives, a global perspective as well as a national perspective, because each country does make their own determinations. Each country will be rolling out this new implementation guidance according to their own time frames. So some countries will adopt it more rapidly than others. And so it's always important that when you're attending conferences, particularly if you're in attendance at an international conference, and the most likely international conference you're all going to participate in is ILCA. And there'll be many countries coming together, and they'll talk about, the new guidance and what some people are doing, what others aren't doing. It's always important for you to follow the instructions of your national authority, because we each do our assessments in accordance to the plans that we put together. And so you may hear maybe the UK has gone ahead and implemented some things that we are still working out here in the United States. So always go to our website, even if you've looked globally for information from WHO, check with us first on where we are with the implementation. And, of course, we'll continue to provide our updates to you through our normal means. So if we could move on to the U.S. instructions. So what's been happening in the United States is that we created an expert panel to guide the change process through the United States. We've incorporated many members of the CHAMPS team on our expert panel because of their great knowledge and experience working with hospitals around the country with implementation of the BFHI. We know their input is really vital to us and valuable to us as we think about how to move forward. So our instructions to you are to follow the current guidelines and evaluation criteria until otherwise notified. So if we can move on to the next slide. So our expert panel met on August 6th and 7th in Atlanta, Georgia. We took the recommendations from the expert panel and we brought that to the relevant committee of our board of directors, which is our clinical committee, and that group had a face-to-face meeting on October 18th and 19th. And I'm really happy to report there's very strong alignment between what the experts thought and what our clinical committee thought, so that's good news. So if we could have the next slide. So our next steps are, and just before this meeting, I was deeply involved in the next steps, which is we're working on the first draft of the guidelines and evaluation criteria. So our clinical director, Tammy Titus, who's listening in on the call, but I don't know if she has the on open mic and can communicate, but Tammy's taking the lead in writing the new guidelines, and we are just getting ready to send them out to our expert panel and our clinical committee for their review and their critique of what we did with the recommendations they made to us in August and in October. And so we're sending them a revised document now, and we're asking them to provide us with some feedback by February. And then we'll work with Tammy and her team. We'll look at the feedback that's given to us by the experts, and we'll work to make revisions, and we hope to have their guidance incorporated into an updated document by April of this year. If I could have the next slide. We will then hopefully convene a second expert meeting in May or June, and hopefully have a final document by July or so. And I'm saying pending, parenthetically, I'm saying pending updated information from WHO on training. Obviously, we can't release a document with anything pertaining to Step 2 until we have final guidance from them on what their thinking is about Step 2. But if we could look at the next slide, again, once we finish our guidelines and evaluation criteria, Baby-Friendly USA's work is not complete. We have a lot of 4D pathway materials that need to be updated. So we'll take the latter part of the summer into early fall to look at all the materials in each of the phases of the 4D pathway. And I don't need to read the numbers to you, but you can see we've got a lot of documents to go through. And if we can look at the next slide, that includes the documents in the latter phases of the 4D pathway. So we've got a lot of materials that we need to update. And if we could look at the next slide. So then our final steps will be that what we need to do is finalize the guidelines and evaluation criteria. We'll determine a rollout date. We'll think about a date for you all to comply with the new standards. And we need to figure out how to manage new reduced standards. If we reduce our new standards, how do we transition currently designated hospitals to any kind of reduction, or if that turns out to be the case. We do also need to notify training companies and patient education material companies about the changes so that they have time to update their programs, and then we'll update the portal in our website. So if we can move to the next slide. So I'm just reiterating, our instructions to you all are to continue to follow the current 2016 guidelines and evaluation criteria, and we will notify you of any changes to the U.S. program via announcements on the public portion of our website, announcements in the secure portion of our website, as well as constant contact newsletters, and we'll keep key organizations informed of changes. And a key organization for us is CHAMPS. Because of their work with you, we want to make sure that they too are adequately informed and can work with you on any changes. So that's generally our communication plan. And we'll move on over. We've got about 15 minutes left, and I'll review some of the questions that we've commonly been asked. So if we could move to the next slide, hopefully we'll have a few minutes just for your questions. But one of the things we're frequently asked is, what are the changes anticipated to be made to the designation process? So if we could look at the slide where I have an answer prepared for you on that. So, again, prior to the implementation guidance being rolled out by WHO, we had already made some changes to the guidelines and evaluation criteria in 2016, and we had announced that we would start doing assessments on the 2016 GEC on November 1st, 2018. The new guidance stalled us for about a month, and we've just started doing assessments on the 2016 GEC on December 1st. So on this Monday and Tuesday of this week, we did our first assessments using the new criteria. And so we don't anticipate making major adjustments to the 2016 GEC until before we incorporate the new guidelines, because there is really a tremendous amount of work associated with that. So if we could just move on to the next slide. So then how do the WHO recommendations in the 2018 implementation guidance impact the assessment of the 2016 GEC? So the answer is on our next slide, if we could have that page. So as I mentioned, as of December 1st, we're conducting criteria assessments using the 2016 criteria. We did announce in June of 2018 that we were rolling back the stricter implementation guidance for Step 9 back to the 2010 criteria. So hopefully you all received that information. We did disseminate that widely. And at this moment, that's the only change that we anticipate until we roll out the new guidelines. So next slide, please. So is Baby-Friendly USA updating any of the 10 steps based on who changes? If so, when? And then any updates for the NICU? So we can move on. So as I mentioned, we've convened our expert panel. We've gone to the clinical committee. The recommendation as it relates to the NICU from both the expert panel of our of the expert panel as well as the clinical committee of our board, as well as a group of international breastfeeding experts that I work with on a regular basis, is there is a recommendation that we keep the NICU separate from the Baby Friendly Hospital Initiative. So the current plans are that BFHI will remain focused on the healthy term infant. There are some aspects of the current program that do relate to the NICU, and you all know that we assess moms who have been separated from their infants. We ask them how they've been helped with getting breastfeeding off to a good start. So that will remain a key component of the program, but actually NICU standards will not be built into the U.S. BFHI other than on a very high level. But there is a NICU program under development, and we don't currently have a release date determined for that. So if we could have the next slide page. Where we are with our NICU, many of you have been interested in the NICU initiative. We have developed a self-appraisal tool and a clinical guidance document. We did send it to several professional organizations for comment in 2017. Such organizations included AAP, ABM, ACOG, all the very logical places that we would go to get their input. We did receive a robust set of recommendations from them, and we built those recommendations into documents that are now being ready to go out for testing. And we're in the process of trying to fundraise to be able to support some field testing of those materials. So if we could have the next question. So we're often asked about, well, are there any tips that we can use to make the NICU as baby-friendly as possible? So if we could move to the next slide. Sorry, my throat is getting dry. We do encourage you to continue to help mothers who have babies that are sent to the NICU to help them to express their milk and pump as soon as possible. We encourage you to think about the use of human milk in the NICU, and we encourage you to think about how the current 10 steps relate to the NICU and which of them are feasible and safe at this point for you to implement in the NICU setting. So if any of you are thinking about, improving your breastfeeding support in the NICU, those are some of the things we'd recommend at this point. So next slide page. We've been asked, are we looking to update the audit tools? There's often a comment about the redundancy of questions on the audit tools. So if we could look at the next slide. The answer is we are looking at the audit tools. We did recently update them to incorporate the 2016 standards. But in terms of them being cumbersome and redundant in some cases, we've had a philosophical debate about, is it best to have a larger number of tools that really dig in on individual steps, or should we have a smaller number of more consolidated tools that don't dig in as much and maybe aren't as helpful to you in surfacing care practice difficulties that you might be experiencing, but they're less cumbersome for you to use. But our ultimate goal is to create a fewer number of streamlined tools that really effectively do the job. So that's a project that is slated that we're working on as we work to think through the new guidelines and evaluation criteria. So next slide. So we know there are many hospitals in Mississippi now that are, that are designated, and soon you'll be thinking about redesignation. So we're often asked about what are some of the most difficult parts of the BFHI for redesignation or recertification. So if we could look at the next slide. So as you're going through this process and as you're thinking about it, we always use the redesignation is the same. The redesignation assessment is the same assessment as the designation assessment. We don't have two different types of assessments. It's the same one. But we always use the most current guidelines and evaluation criteria to conduct re-designation assessments. But we use them in accordance with the implementation time frame that we told you we would assess by. So any hospital due for redesignation now is being reassessed based on the 2016 guidelines and evaluation criteria. So that's going to be the case until we tell you we're going to be assessing on the 2018 standards released by WHO. So one of the things that we find designated hospitals struggle with is then making sure they retain sufficient documentation for step 2, because whether this is the best standard or not, we do only require that the 20-hour training take place only once. So staff who've been working at your facility for a number of years may have taken the training 5 or 6 years ago. We do need to see the documentation during the redesignation assessment. So sometimes that documentation gets misplaced. So it's really good to think about that now to make sure that you retain evidence of staff training for the duration of the time that you retain your certification. We also had folks struggling with retaining documentation of the clinical competency verification. So just be mindful of that as you're thinking about things you can archive or shred and what you need to retain over a longer haul. The other thing that we find sometimes catches facilities off guard is that healthcare is in such a dynamic state that sometimes there's changes in the facility structure since the initial designation, and that surprises folks that their redesignation assessment may be a little bit different. So an example is that some of your facilities may have started out when we may have assessed you, you might not have had an affiliated prenatal service, that over time you acquired one, or you discontinued one, or you acquired a NICU, whatever. So just be mindful of changes in your facility structure that might impact the 10 steps, because as you're preparing for on-site assessment, we look at your facility as it is at the time of assessment, not as of your original designation. So if we could have the next slide. So another thing, any suggestions or tips to keep in mind? And so our suggestion is always keep your multidisciplinary committee together, even post-designation. The committee probably doesn't have to meet as frequently post-designation as you did in your work to become designated. But the committee serves an important focus, reviewing audits, audit results, reviewing safety issues. That committee will be helpful as you prepare for the on-site assessment and readiness assessment feedback call. That committee should be called upon for updating your feeding policy and be a part of the negotiation of purchasing of products to be in compliance with the International Code of Marketing of Breast Milk Substitutes. So if I could have the next slide, please. So that's really the end of my prepared. I've got about 6 minutes left for any questions or comments you might have. So, but always, thanks for all that you do. We know you're doing an amazing job with caring for mothers and babies, and thanks a lot for that.
Yeah, so if anybody has any questions, feel free to type them out in the chat box, and I will read them aloud just so that nobody ends up talking over each other. It looks like we have a lot of people listening in today. During the presentation, we did get a question. This is pertaining to the new 10 steps. And our audience member asked, how do you interpret staff in step 2? Does this include nurses, physicians, APNs in terms of their competency and skill requirements?
Yeah, so it's an outstanding question, and it does go into the category of we are still looking at waiting for guidance from WHO, but let me not shove that question off and not answer it. So we predominantly look at those providing direct care to mothers and babies in the newborn, the immediate prenatal and newborn period of time there. And so depending on, there's likely to be some flexibility depending on the kind of care different levels of staff are providing, what their competencies are going to need to be. And I think that's One of the flexibilities WHO is looking to provide to us, and we haven't seen their final document, so I want to be careful about not setting too many expectations. But some of what our thinking is at this stage of the game is trying to, match competencies with job duties. And so each facility will use people a little bit differently. And so there may be some broader categories of what the competencies are based on various tasks performed.
Great. Does anybody else have any questions in the last few minutes that we have here? I'm not seeing anything come through the chat, so go ahead and ask directly if you have a question. We'll just try to keep people from talking over each other. Does anybody have any questions?
So, and there was an awful lot to digest. So let me just take you off the hook page and just say, there was an awful lot of information, and there's still a lot of what ifs. So, please feel free to invite us back to clarify as we continue to have updates. We're happy to rejoin you and answer some of those what ifs as we answer those questions. So I know there's a lot of hypothetical I went over. It's a bit of a heads up. And folks might need some time to digest what was said and generate some questions, but they probably want a few less what ifs and a lot more concrete from us. Maybe that will generate more questions.
Yeah, well, it sounds like there are a lot of changes coming. They sound really exciting, and we'll look forward to seeing them as they are rolled out. Thank you so much for presenting today.
Have a day to you all.
Yeah, if anybody has any other questions, feel free to reach out to us, and we'll follow up with you.